Hi, you guys, it's Dr. BT, and we're going to talk about breastfeeding. Um, Recommendations for infant feeding. Obviously, scientific evidence has proven that breastfeeding is much more superior than bottle feeding. It's the best nutrition for babies. It's high in calories. It's high in antibodies, IgG, IgM, and such. It also has a lot of protein and a lot of good fats. So it's the gold standard for feeding. The American Academy of Pediatrics recommends that you exclusively breastfeed for the first 6 months. So the baby gets nothing but breast milk. And then after introduction of food at 6 months, they would like you to continue to breastfeed until 12 months. Okay, so the evidence supports breastfeeding as the ideal form of milk. You really want to talk to your patient about the benefits of breastfeeding. They're numerous. I mean, it comes from anywhere from IQ points to reduced obesity in adults, decreased asthma, and then the risk of not breastfeeding. They don't get those long-term effects. Of course, if they don't breastfeed, they don't get the enhanced bonding that you get from breastfeeding a child. It's super convenient and inexpensive. A good way to kind of correlate to mothers is, I say all the time, it's very hard to wash all these bottles and sanitize these bottles and make the formula and buy the formula. Your breast milk is free and expensive and easy. It's always warm. And then environmental benefits of not having the bottles around. So the decision to breastfeed is definitely the mother's decision. You just really want to give her all the information she needs. Certainly she can bottle feed and be okay. And that's a personal decision. So we certainly don't want to try to coerce someone. Breastfeeding, usually their decision is made by what their family does, and as long as they have good family support, they're pretty good. Cultural factors, some cultures don't support breastfeeding, most cultures do. And then sometimes moms don't know a lot about breastfeeding and just need more education on how to make that decision. Barriers to breastfeeding. So you guys, a lot of times in the U.S., more so, modesty is a huge thing, and so breastfeeding sometimes can be viewed as immodest by certain groups. Breastfeeding is definitely a natural thing, and you can be very overt about doing it, or you can have a blanket. So you guys, you need to really give your patient information about that they can breastfeed, and if they're very modest, there are things available for them. Formula companies obviously make a lot of money off of formula, so they appeal to mothers by really appealing to the fact that dads can be involved and give the baby a bottle. So you just have to talk to them about dads can have other roles other than formula feeding a baby. Lack of prenatal education. You guys, a lot of moms, they just don't know about the benefits of breast milk. So you really have to talk to them. You hope that they seek prenatal care and they get this information in their prenatal education classes. If not, you want to give them this information in the hospital. Employment needs. There are federal laws that protect women in federal buildings. State laws are different. In the state of Florida, you can't discriminate against a woman who's breastfeeding, but it can be very difficult for some people on their jobs, depending on what their job is, to have a place to pump. So you really want to talk to her about that. Pain, lifestyle incompatibility. Pain, you guys, really, we shouldn't have pain with breastfeeding. When we get an inappropriate latch in the first couple of weeks, it can be painful, and of course we advise the mom to take the baby off as soon as she feels pain. Pain is a signal to us that things are, that the latch is incorrect, and if the baby continues to feed with an incorrect latch, that can cause laceration to the nipple, which is not what we want. Lifestyle incompatibility. You guys, you can't ingest drugs that are not safe for the baby. So, some people don't really want to breastfeed who want to have social drinks and such. So you can tell them, yes, you certainly can go have a glass of wine or whatever. You just pump the breast milk after that and dump it. You just don't give it to your baby. So there are some lifestyle alterations that have to be made, but certainly breastfeeding is the easiest thing to do. Formula feeding, so you guys always support moms who want to formula feed. You want to give them the information, but ultimately it's their decision to make. So you want to talk about the risk and benefits of each, the risk and benefits of breastfeeding and the risk and benefits of formula feeding. Really, the baby just doesn't get the benefits of breastfeeding when the baby formula feeds. It's expensive and it requires a lot of work. You need to talk to them about cultural beliefs. In the South, they'll say, oh, that baby needs some water and K-Rose syrup. You guys, babies should not have anything but formula or breast milk for the first 6 months. If they have water or sugars in water, such as K-Rose syrup, you guys, that can lead to electrolyte imbalances. There's just a couple of contraindications to breastfeeding, and usually these are disease related. So people who cannot breastfeed are the babies who have galactosemia, which is too much sugar, mothers who are positive for human T-cell lymphotrophic virus 1 and 2, mothers with untreated brucellosis, mothers with active TB, mothers with active herpes of the breast, and mothers with HIV infection. Those are the people who cannot breastfeed. Cultural influences on infant feeding. Immigrants to the U.S. from poor countries often choose formula because it's associated with a higher socioeconomic demographic. And you guys, that was back in the 80s and 90s. Now you guys are higher socioeconomic demographic all want to breastfeed. Breastfeeding beliefs and practices. There are some cultures that believe breastfeeding can be harmful based on the type of colostrum or the color of colostrum. But you guys, breastfeeding is always good in the absence of moms ingesting things that could harm the baby. So how does breast milk provide the baby with nutrition? It provides energy, fluids, fats, carbohydrates, proteins, and minerals. So you guys, all the nutrients are there, plus it has antibodies, which is awesome. There's IgG, IgM, IgD, IgE, and you guys, this is like giving your baby antibiotics, so babies are more healthy. So the anatomy and physiology of lactation, the alveoli is what produces the milk producing cells in the lobules, and we've kind of talked about this before when you did your anatomy review. Myoepithelial cells contract and send milk to the globules. It's super complex. Moms have to have a little bit of extra food to produce this breast milk and fluid, obviously. We keep them still on that 300 extra kilocalorie a day diet until they're finished with breastfeeding. Again, here we can just see, here's the milk ducts right here. I do want to say this, is that people ask quite frequently, can I breastfeed if I've had a breast surgery? So the most common surgery that women have are breast implants. And so you guys, the most common form of breast implants or the most common procedure for placing implants is they place a silicone breast implant behind the muscle here. So if it's behind the muscle, okay, behind the pectoralis muscle, it does not damage any of these ducts. If a breast implant is placed in front of, or in this area, in front of the pectoralis muscle, obviously, where the surgical incisions were, there will be damage to the tissue and scar tissue, and that can cut this ductal network. And so if you've had a breast augmentation that is in front of the pectoralis muscle, you will have decreased breast milk. If there was a breast reduction, many times that's actually taking out this tissue And when we take out that tissue, you guys, obviously we've removed ducts, we've removed alveoli, we've removed sinuses. So you guys, it is not going to be beneficial to try to breastfeed if you've had a breast reduction surgery.